Hi everyone, Dr.po Raval. Welcome to Archmaker. I have been a podiatric physician for 35 years, and today I'm excited to talk about PRP injections. It was a question on my TikTok channel, and I want to answer it here. So what is a PRP injection and how does it relate to plantar fasciitis? So PRP stands for plasma-rich protein, and what happens is your blood is actually spun down to only retrieve the plasma. That plasma is then injected into the plantar fascia muscle, which is on the bottom of your foot. So why plasma? Plasma is very rich. First of all, it helps you clot, but it's also very rich in growth cells. And presumably, injecting this PRP into a tendon that is painful or torn helps grow new tissue. And I say presumably because it is not FDA approved, so know that even though loads of professional athletes are using it among other people, it is still considered experimental. I myself have been using it for many years. How does this relate to plantar fasciitis? So first of all, it should never be used as the first line of treatment. You still want to look at the link in my bio, which over 35 years I found that the order in which you do things is what cures plantar fasciitis. So as a review, we always look at the bottom, the plantar fascia muscle, and on the first visit, we see if the muscle is tight. We look and touch the bone to see if it's related to a bone spur in the heel. So if there's heel pain along with plantar fasciitis, if it's tight, you go to physical therapy. It is always followed with an insole or a custom orthotic. And the next thing is we always check the shoe and make sure it doesn't wobble. So those couple things have to be done first. Physical therapy isn't just to loosen up the tendon, but it's to build muscle memory. Muscle memory is what eventually will stop your plantar fasciitis from coming back. We always get an x-ray on the first visit to see if you also have a bone spur. If you have a bone spur, we definitely put you in more of a custom orthotic because you don't want that spur to grow. After 4 weeks and after presumably you have muscle memory from the orthotics and physical therapy, you then go on to see what's left. If there is still pain in the plantar fascia muscle, that's when you get an MRI. The MRI will tell you whether there is tissue damage, scar tissue, or a tear, a tendon tear. So if there's a tendon tear, you then take your orthotic and your podiatrist will put you into a cast boot. A cast boot you can walk around in, but it will try to heal that tendon first. Again, 4 weeks, if it is not healed, and you still have pain, that's when you go on to a PRP injection. So it should never be done first. In my opinion, it should always be done last. First, because it's not FDA approved. And also, you want to cure all these other things that are more conservative before you end up with a PRP injection. And by the way, you can repeat a PRP injection. So if, let's say, we find a tear that's still not healing, and then we give it a PRP injection, I always wait at least 4 weeks, get another MRI, see if anything's changed. It may warrant another PRP injection. So that's where plasma-rich protein injections should be used, in my opinion. They should be the last item in the cure for plantar fasciitis. Hope this helps.